Welcome to Inside Startup Investing, the only podcast where you can invest in every guest. On this episode, I will be speaking with founder and CMO of Elemeno Health, Arup Roy-Burman. So what is Elemeno Health? Do you ever find yourself in your kitchen and realizing you need to use an appliance you haven't used in a long time, like a food processor? And you probably wish you hadn't thrown away that manual that it came with. And now you're trying to figure out how to use it. Well, imagine that experience, except you're in a hospital setting. You're a physician or a nurse, and you need to figure out how to use a piece of equipment or enable a process that you haven't had to deal with in a really long time. When a life is on the line and time is of the essence, you don't have time to be running around looking for a manual. Well, Elemeno Health is an at-your-fingertips platform that is built to help medical professionals in a hospital setting quickly access the information, training, and knowledge they need to manage any process, piece of equipment, or whatever else it is in a timely, efficient, and thoughtful manner. A few things that stood out to me about Elemeno Health are first, building a powerful, essentially pocket guide on your phone for hospitals to easily provide the knowledge hub their providers need for timely information and resources to navigate their day-to-day comes with incredible complexity and challenge. For instance, the knowledge an emergency floor needs will be different from a paternity floor, and so on. More importantly, hospitals are notoriously difficult when it comes to implementing new technologies and dealing with change. Which leads me to the second thing, which is Elemeno has been through it, building this solution over the past 7 years with pitfalls and challenges along the way, including a down round valuation. But what's so exciting about this business is that while they have had hard times, they've worked through the inevitable challenges of building a new solution for the hospital market. But with the right executive team in place, real traction across a multitude of hospitals, and a growing word of mouth around their business, which is building comfort with more hospital operators, their pipeline is growing quickly and their deals are starting to close more rapidly. Lastly, Arup and his team have strong capital partners alongside them that have continued to back them as they see the massive $600 billion plus category they're in and the opportunity that's in front of them. They have put in the blood, sweat, and tears to get this business to product market fit and are now at a moment in time where we see a chance for a real inflection point of adoption and growth. That is why King's Crowd Capital is backing Arup and the Elemeno Health team. So with that, let's get on to the show and welcome Arup. Arup, thanks so much for joining us today.
Absolutely. Happy to be here.
So for those who don't know you, give us a little bit of background on yourself and what Elemeno Health is all about.
Yeah, so I'm a ICU physician. I used to be medical director at UCSF. And there we struggled with how do we keep our staff, things like our nurses and RTs, residents, how do we keep our team on the same page with constantly changing information? And on top of that, with constantly changing staff. And we said, in our consumer lives, there's technology such as this that is the great enabler, giving us what we need in that little bite-sized chunk right when we need it. Why can't we have the same in healthcare where the stakes are so much higher? And that's what Elemeno is about. We're a just-in-time microlearning application specifically designed for frontline operations. So that means, healthcare is local. It's not just about, hey, these are the best practices that we should do, for example, for COVID. What do I need to do in my hospital, in my ICU, with the people that I have and the resources and equipment and supplies that are specific to my organization? It's all that bit of customization. And that's what we do through a mix of technology and service to give those staff the bite-sized content in little video and pictures and interactive decision guides that they can pull up in the moment so that they can deliver the right care to the right patient in the right way at the right time.
For those of us who don't work in healthcare, give us an example. What does it look like today? And then how does Elemeno improve on that?
Yeah, okay. So say that I'm in the ED and now there's a trauma coming in. Right? This is a classic of high risk, low frequency. I'm not doing 10 traumas a day. It's coming in every few days or every few weeks. And it's like that patient is hemorrhaging out. I got to get blood into him real fast. How do I do that again? what do I need to order, or how do I order it in the EHR? Oh, and I need to use that rapid infuser that's in the back closet, the Belmont. How do I operate at that again? So when you go into Elemeno, it's like, boom, to activate the massive transfusion protocol, do this in the EHR. And then, oh, you need the Belmont? Grab it. So this is a real example out of here in the Bay Area, North Bay Health. It was an ED tech who wrote to her manager the next day, said, we had a transfusion, that we had a trauma come in. And I was like, oh crap, I got to set up the Belmont. And she goes, I was shaking, and I was like, is the trauma surgeon going to be yelling at me if I can't do this right? So she goes, I pulled it out, and then I opened up Elemeno, and I said, oh, this is where I hook these things up. This is what I need to really push this in to get the pump to work. Boom, I had it set up, and it worked perfectly. So that's like an example of healthcare is full of all kinds of high risk, high complexity practices that you don't do day in and day out. And you've got so many different things. If you're in the ER, you're the OR, the ICU that you have to deal with every day. How can I have that tip sheet at my fingertips? Because the way that it otherwise happens is that I'm like, can I go in the back room and find the manual and try to read this? Or, you know what, let me go ask somebody else if they remember, and they can ask someone else. You get this game of telephone. Or, you know, where was that flyer? Is it over there in the desk? You need to get rid of that time between training and remembering. Give it to me right here, right now.
Now, are there, 25, 50 things that are kind of the high priority kind of standardized things you see in every ER or whatever floor it may be? And I only ask that question from a building this out, to your point, there's lots of nitty gritty, intricate things. How is that scalable when there's so many complexities and things you probably need to cover in this tip sheet?
Yeah, so example, that's great. So let me give an example. Like, play off that same Belmont example. That Belmont Rapid Infuser, that one, North Bay did that content. And then they put it up on the Elemeno Cloud. So we've got a resource sharing network that all of our clients contribute to. Now, every other ED in the country, they've got the same problem of what do I do when the trauma patient comes in? And, a good chunk of them use the Belmont. And so then those managers looking, ooh, I like what North Bay had there. I'm going to grab it. And you know what? The only thing I need to tweak is that when we dispose of the blood afterwards, instead of dumping it in this, down the sink or something, we're putting this into this biohazard bag. So they just make that modification. So they're not reinventing the wheel. So as the community grows, there's more and more of these shared practices. And to your point on, what are the core problems? Every hospital is measured on certain core metrics, like on certain kinds of hospital harm, hospital-acquired infections that happen. And so all the ICUs are dealing with that. And so they have slight variation of how they do it. So, yeah, are there like 50 things? Depends on which department you're in. Some it may be like 20 common things. Some it's 50. Some it's 100. But there is that common area. And through our cloud, we're able to unite and de-silo those individual units that are just, hey, I don't have any peers. I don't have another ED in my hospital. But now through Elemeno, there's all these other EDs out there that are like me, and I can start learning from them and sharing my knowledge with them as well.
Well, you mentioned that there's tech and there's service. What does that look like? How much hand-holding is involved in this process as well?
Yeah. So, when we think about going out to help nurses especially, that's like a huge chunk of our client base. They're overwhelmed. They have very little time. How do we make it easy? Don't just drop technology on them, but make it easy. And so what we have is a client services team that can service a hospital by service line or groups of departments. And Chris, if you are a client, then one of our client success managers, when we start out, would meet with you over Zoom once a week to make sure you're up to speed, on this, teaching you how to use the self-service tools, showing you how to share and access the shared resource library, getting you up to speed. Once you're up to speed, then if I were your client success manager, I'm available to you as a coach. So when you've got your quarterly priorities, you can say, hey, Arup, this is what I'm going after now. And you're like, you know what? Here's some tips that other people like you are doing. So we're there as a ongoing relationship, but as that relationship matures, they're more and more into self-service in the technology.
If I know one thing, it's that the hospital segment is very averse to change, and selling into hospitals can be exceedingly challenging.
Yeah.
What does the process look like to enter hospitals? What does your traction look like there? And how are you mitigating some of those challenges of entering the hospitals?
Yeah. So we're a land and expand model, and one can also call that a prove and expand. So we tend to go into the highest risk areas of the hospital, like the ER, the OR, or the ICU. And those are areas of the hospital that are incredibly well respected, because that's where the stuff really hits the fan, right? And so if we come in there and prove value, that unit leader, that department leader is our champion, who then advocates for expansion across the hospital. So historically, it had been we start in one department and then expand out. As we've gotten more and more clients, we're in like 40 hospitals now around the country, we're taking bigger and bigger bites to begin with. Sometimes it is the whole hospital. Other times it is a handful of units. But once we prove that, it's not just growing up to the hospital. We then have the opportunity to expand across the hospital system. And if you look at the healthcare landscape today, individual hospitals are all being gobbled up by bigger systems. That's the reality of the economics. And in that economics, they want to be able to scale their knowledge. We provide a platform to do that, that is, agnostic of how far apart you are or when around the clock you are. So we give that opportunity to help the leaders to scale. And when you also talk about and selling into hospitals, healthcare is a really risk-averse industry, right? The adage is first do no harm. And that tends to be, most hospitals says, I don't want to do anything new. So that was a challenge for us from the early days. How do we break into the first hospital, show something that works, and then from there, they say, well, it's just in that hospital. So then we have to do it in another house and another. But once we've done it in a handful and we've done it around the country, what we see is people then start looking at, hey, my neighbor's doing it, I should be doing it too. So we're starting to move from being the novel item to starting to be seen as a standard of care. That switch is happening. The other piece that I would put into this is that in that risk aversion, I think you've heard so many things this year about, change healthcare and all these kind of, IT disasters. Those are all with technologies that dive deep into integrating with the electronic healthcare record and pulling in protected health information. We don't want that PHI. We're about your staff and we're about processes. That makes us incredibly agile, makes us simple, makes us low risk. So those are some of the different things that we've done to mitigate those challenges you're talking about.
I know there's been, fits and starts with this business, and I think it's been that challenge of figuring out how you get into the hospital, how you get them paying. What does that look like? And what have you figured out in terms of the business model that's now allowing you to accelerate growth?
Yeah. So I'll say I came into this naive.
As we all do.
Yeah. I'm a physician. I went into medicine to take care of people. I want to give them good quality care. And, it's a blessing in this healthcare industry to be always surrounded with like-minded people. The wonderful nurses that we work with and the RTs, everybody's there because they want to help. And so when we developed this solution, we were like, hey, how can we help people like us deliver even better care? We did that. And when we spun this off as a company, we thought that hospitals would say, hey, here's a solution to deliver better care. I'm buying. And instead it was, hey, that sounds great. But reducing mistakes, improving quality, that's avoidable costs. And I don't have a line in my budget for avoidable costs. So they really didn't want to buy quality. There's a lot of talk about it, but the desire to pay for it is low because it doesn't directly hit their bottom line. And so we kind of suffered through this learning process over the first few years of the company. And then the pandemic hit. And in the pandemic, now some of our clients said, I'm using you guys for quality improvement. I got a whole new another problem now. I got all these new people coming in. I got these travelers coming in. I got this constantly changing information. Maybe I could use you just to be able to give that information to people in the way that they can quickly digest it and understand it. And I can do that without bringing people into classrooms and trying to, teach them that way. I can do it quick and easy and refreshable. Great. So we started to do that. And that's when we saw, we can extend this to onboarding and orientation of the workforce. So now as your new hires are coming in, if they are getting their training instead of in a classroom, they're receiving it here. And they're getting it in a place that they see it once and they can go back to it over and over again. The time that it takes from quote unquote door to floor, from when you first hit the hospital to when you're ready to go on your own, instead of like this, it's like this. And that's when leaders said, the financial leaders, hey, I got a budget for onboarding and orientation. I got a budget for all this extra preceptor time. Wait, if you're cutting this down, you're saving me hard costs. That was the pivot that happened in 2022 that really started to unlock the business and increase that attraction. Because now for the first time, we were aligning the champions for quality with the champions for money. You get everybody together, you can move faster.
And what is the business model today? How do you charge hospitals?
Yeah, so we're a subscription, but instead of the traditional, like I think many people think about on the consumer side, it's a subscription by each user. Here we're selling to the business. So if we're selling to an individual department, we have an annual subscription for that department, but within that, it's unlimited for the content that they bring in, unlimited for the people that they bring in. So if you could think of me like a unit manager, I don't get nickel and dimed all of that stuff. I just have Elemeno here to help me with whatever it needs to get done with whoever I need to help. And if we're talking about at a hospital level, then we price it out by beds. So, a smaller hospital is higher per bed, a bigger hospital is less per bed to bend that cost curve.
Got it. That makes a lot of sense. And then in terms of kind of accelerating growth, I know you have new executive in place. What are the things you're doing to really start growing sales and top line revenue?
Yeah, so that's a great question. So we looked at two things. One was how could we really streamline how we are closing deals? I'm super excited about our new CEO who's coming in. This is Tim Coulter. Tim, fantastic job. He was an early executive at Medicity. At Medicity, it's like a health information exchange company, one of the pioneers there. There he helped to lead their growth to 100 hospital systems and about 1,000 hospitals. He also ultimately helped them to lead an exit to Aetna for $500 million. The founding team there really loved Tim, and so they started a new company in health tech called Dina. And when they started Dina in 2016, they brought Tim in as their president and COO. He's led their growth. They've been back-to-back in 5,000 years and named Inc. 5,000. And then just this past year, or this year, Newsweek named them to 2024's best digital health tech companies. Now, Tim has a philosophy that until a startup in healthcare reaches about 10 million ARR, that the founders and the C-suite should be the ones that are directly closing deals. This goes back to the original comment that I was making about healthcare being this risk-averse industry. So, Chris, if you're a hospital CEO and I'm bringing a new technology, you want that relationship with me, that trust, if I'm going to be implementing it here. So that's a change. When I look back at what we've done on the past few years, we were probably premature in trying to build out an organization of delegating down to lower level AEs to be able to take these deals to the finish line. That provided to us a lot of cost burden where we found that still maybe I was involved in closing a lot of deals or senior execs were. So with Tim coming on, because he likes to roll up his sleeves and he's done a lot of this, that really helps us to be able to tag team to close these deals and do so at a lower cost. So that's one of the changes that are happening here with Tim coming on that I'm excited about. So we've lowered burn. And in fact, with that, we're about $500,000 of new deals that we've had in Q4.
Wow.
So that's been a really nice Q4 for us. But the other thing that we're doing is exploring and stepping into a whole new market. And that whole new market is not wholly different. It's right next door. That's in pharma and clinical trials. And so I think just came out today where PharmStars, kind of like the preeminent pharmacy tech accelerator, just announced us as one of their latest graduates. And the focus of this cohort was on digital innovations in clinical trials. And what it is for pharma is that pharma, when they push a new drug out or they're trying to develop a new drug, they got about this much time on a patent. And clinical trials take up a chunk of that. The faster the trial can be done, the more that time is left on market. Each day that a trial is delayed costs pharma $500,000 in unrealized sales. And what they're trying to solve with clinical trials is, how do I close the gap between my clinical protocol and my trial execution? It's very much like what we do in healthcare, of closing the gap between hospital policy and frontline execution or frontline practice. And so they saw that analogy, and we're working now with pharma. We've got a number of clients or prospects that we're deep in discussions with to be able to help them in shortening trials and to be able to drive their own internal efficiency. So that's a whole new market with a lot of dollars on them, but it's a leap that is just actually a short skip from what we're doing now successfully today.
Understood. When you think about the capital being raised in the current round of funding, how is it going to be applied in terms of use of funds? And where do you think that takes you in the next 12 to 24 months?
So the capital that's coming on here through WeFunder, and we have a parallel Reg D raise that's going on. The goal on those is that we'd like to bring in $1.25 million with that. And with that, and we have actually on the Reg D, we have a commitment for that already. So with whatever we come in for with WeFunder, that's going to be gravy. And so that is already looked to take our runway into 2026. And that is playing on a conservative sales forecast. I think we've been burned too many times. So we've worked with our VC backers to keep something that is really low, and so that if anything, we can overperform on that. In fact, it looks like we'll be ending up 2024 ahead of where our current schedule is. But that's how much we're looking to raise and how far it's looking to take us. Where is that going? That capital is going to be able to serve us with sales. So on the sales end, it's not to hire up more of a team, but it's actually to morph a bit of what our current team is doing to take our client success folks who are historically been more passive in supporting the client, to make them active with the client, to be able to proactively farm them, to be able to do more expansions. It's also going into product. And in product, what it has to do with is taking us from this just-in-time reference to be one that can also help you over time. Over time in the sense of what many hospitals have told us is, you're great for training up my nurses. I would love to be able to check off their competencies here in the application. And that means checking off and tracking something over time. Can I do that here? So let us build that in for you. It's the same thing that pharma and our Kaiser clients who are in clinical trials are asking. I want something that can help me check off over time how I'm doing with matching up with my steps on a trial. So there's some product pieces that we're doing as well to be able to grow not just the value to the client, but able to grow up, the opportunity of what we can sell too, the value props.
For those who are on the line or thinking about investing and haven't decided yet, I'll give you the last word. What would you tell them?
Invest. This is an exciting place. Just today there was a podcast that Andreessen Horowitz put out talking about the future of AI and technology in the labor market, and the tagline on it is that, did you know that the nursing market is worth $600 billion and there's virtually no software to serve them? We're one of the ones that are. There's a huge opportunity here, not just in healthcare, but in pharma as well.
If you like what you heard on the show today, you can check out why Elemeno Health received an investment from Kingscrowd Capital at kingscrowd.com. You can now invest on WeFunder until April 30th, 2025. And please like, subscribe, and share our podcast wherever you listen to podcasts so more listeners like you can find us. Thanks for listening.